Okay, well, good evening, everyone. This is Tuesday, 6 o'clock in the evening, where we are at Tustin Longevity Center, Southern California. This is July 22nd, 2025. And we do this every week, Tuesday, 6 to 7 p.m. We're doing this as a support for our patients, family, and friends, where we have this YouTube where you can ask questions. I'll do my best to try and answer the question. I don't know everything, but I will certainly try. I'm a general family practice physician with a boatload of many decades of anti aging functional medicine under my belt. So, with my father in food research since I was a child, and I'm now going to be 72. I have a lot of decades of experience in the entire alternative medicine world, and I am so happy to finally see the glass ceiling has been broken, and finally, many doctors are coming to learn, to ask, and to discover better health, better ways to help their patients. It's truly an exciting time. It's a optimistic time. There's work to be done, yes, but it is an exciting time. And so I am with happiness here to see people asking more and more intelligent questions. And I will tell you what I think with 44 years of practicing medicine experience will lead me to try and help you to be successful in your own personal health pathways. So we do this with email questions. You can ask these questions through contacting us at tlcdoctors.com, tlcdoctors.com. And there, that'll come to our intake and kind of identify the title for questions for the YouTube show, Ask the Doctor Anything. I think that's the title of it, Ask the Doctor Anything. And then there's a link on that site. You'll be notified every week of information from Tustin Longevity Center and when the YouTube is going to be coming up. And that link will allow you to open up to type in a certain number of characters for a question. And that's how I get these several email questions. The other way to address it is to, if you're on YouTube, just type in live questions in the chat section, and we go to the chat live first, then we go to the email questions, and that's kind of how we run this. So if this is helpful to you, if this is a support to you, your family, and your friends, please please subscribe. That will help to get it to more friends and people and support their health. We are not doing this to give you medical advice. Rather, this is educational. I'll be giving you my gut feeling, my without prior knowledge of the questions and stuff. I just see this because I'm at the end of a full day hard work since 8 o'clock this morning, nonstop. And then I always am in my workout clothes because I usually do my weightlifting and my workout right after work, and then I come here to finish this YouTube up on either often Tuesdays. Sometimes I work out on Monday, Wednesdays, and Fridays. So let's start and begin by saying the YouTube chat. We start with SPM Jen, and she says hello. Praise the Lord. Hello, SPM Jen. And Barbara asked the question, hello, my sister, who is a TLC patient, recently felt a nodule in her belly button. She moved it around and it seemed to break up. She also has a small rash around her belly button and around her trunk. What do you think of lion's mane? Lion's mane is an herb to combat anxiety, and methylene blue for energy and focus as supplements. Well, methylene blue has been around for decades. I first started trying and even experimenting with methylene blue, I think back in the 1980s. So it's an old antioxidant. It is understood to work at complex 4 in donating electrons in the mitochondria, which is an energy unit. Um, and then it falls out of favor, so it comes and goes. So, over the many decades, I'm almost a half century of experience here now. I'm going to say I am not necessarily impressed with methylene blue, and I am going to suggest there are more foundational, valuable things you can do for longevity and energy. For instance, if you are not shutting off your phone and you're staying up late watching YouTube and you have your laptop in bed with you, or watching TV in your room and you have your light on, and then you finally roll over to go to bed at 11:30 p.m. and then you have trouble falling asleep and you don't get a good night's sleep and you wake up not refreshed. um, Part of the problem is the electronics, the certain wavelengths of the light that you're stimulating your brain with through your pupils at night is going counterproductive to how God set up the human body and most mammalian animals to live a healthy life. It is stressful on your immune system. You keep on doing that and not getting good rest and repair at night. And very often we snack in bed, we eat too late. All these things add up. The sugars climb. We're not exercising. We're stressed. We're eating processed, glyphosated foods. And then we go to an article on methylene blue as if I can put some drops of that in my water because I saw someone see JFK Jr. put this on his water on a airplane flight on Air Force One with the president, and this makes it the thing to do. Well, I'm going to tell you that is just following like a child. Really, a mature adult knows what they need to do. Shutting the lights off and getting in bed as close to 9 o'clock as possible, because the star and the moons and the sun and the earth have a geomagnetic impact on your body energy and each of your cells metabolism. The amount of water you drink will help you relax and help you detoxify. The amount of electromagnetic energy devices you have on and how late you're up will impact you. How late you eat will impact you. And all of this steals your energy. So let's stop glorifying a single thing like methylene blue. I'm not trying to tear it down, but I don't recommend anything like that unless the person is first low carb, getting rid of the processed food, exercising, both weight training and aerobic, drinking half their weight in pounds as ounces of water daily, not staying up late with electronics taken out of their home, or their bedroom rather, and then trying to get up with the sunshine, grounding, getting their feet on the wet grass for 2-3 minutes, getting their electromagnetic kind of sequencing with the earth. The earth is electronegative through your bare feet, and energized with the infrared light in the morning that impacts all your cells. And then don't eat late. Try and stop eating in the early afternoon. Eat a rich protein diet in grass-fed, wild-caught foods, prairie-raised poultry, things like that. And then you can talk about methylene blue or a supplement that may or may not be of value. So that's the direction I would go in. The foundational things work. Now, whatever this was she felt in her belly button, I would have to see it. I would have to look at it, and I would have to see how the skin reacted to it. It could be that there was some, bug that crawled in there and died, and she rubbed it around, and then the chitin, which is the exoskeleton of a bug, cracks up into little particles, which are like little glass pieces, scratches and punctures the cell membrane of the dermis layer, and allows bacteria to crawl in through these cracks and then inflame the area and you get rash or redness. So there's all kinds of things that this could be. You would have to bring her into a doctor. I would have to see it to look at that and find out what it was. Um, I'm not off the top of my head aware of what lion's mane is. There are many herbs that are immune boosters, but I'm not impressed that lion mane of itself is uh, an item that would help with anxiety. But I am aware that if her age is menopausal, we lose our hormones with age, and estradiol and progesterone are calming agents, and progesterone helps us sleep. Exercise helps us with anxiety, and not staying up late, getting the electronics away, is associated even with autistic children to calm them down. So no, I don't think it's a deficiency of an herb. It's rather a need for other disciplines to bring into your life a rich protein, healthy fats with adequate hydration, exercise, light control in the bedroom, not staying up too late, not eating too late. Find out your blood type, and if you're A type blood, in general, that blood type has the least amount of digestive enzymes and uh, uh, hydrochloric acid is what I'm trying to say, to help break down and digest the essential nutrients you need to get out of your food to make yourself feel well. And if you are at a molecular level having deficiencies, your body will send out unwell signals that we call anxiety. And so, orthodigestive enzyme, if you're a blood type A, no matter how young you are, I start children on this at the age of toddlerhood. Tell their mothers about if they're blood type A, they should get a little hydrochloric acid digestive enzyme with their protein so they tolerate it better. So there's many things that could be going on, SPM Jen. So hopefully that's food for thought, and find a good functional doctor, work on the foundational things. And then once they're done, then we can talk more about more exotic things like methylene blue and lion's mane as an herb for anxiety, things like that. All right. Great is thy faithfulness. Ask the question, what do you recommend for dandruff that flares up for unknown reasons? Typically, we are all falling prey to the marketing of the Wall Street and money companies to sell us stuff with false and vain promises, uh, telling us to take something when we bathe, or take something when we shower, or put something on our hair when we wash it, to wash frequently, to use deodorants, to use colognes, to use body oils, to use uh, uh, candles and scents, and to do all these various things to ourselves, when in fact, on top of that, all the marketing on the food, every piece of food that goes down our throat is to be a burst of excitement and thrill for every little drop of food that goes down our throat. Water isn't good enough. You have to have some entertaining flavor or excitement to every drink you take. And so we are being marketed to the point that we're showering too much, putting God knows how many chemicals on our skin, which is a tremendous mechanism for delivering um, uh, medicines. You know, we use estradiol topically. I put estradiol on myself every day and it's absorbed. So my skin is a tremendous absorbent. So we are marketed to all the time. And then find out your blood type, because if you're not at blood type A, you can't digest your fats as well, without which you can't make healthy membranes, which means you will have cell uh, debris as the dermis grows out and you get the dead cell pile up. With low fat intake, you'll have more dried cells. The more you use soap on your skin, the more you will dry off what healthy little bit of oil you have, and then that will dry and crack up and flake off more. So I try and only shower my whole body once a month or every 6 weeks, and I do sponge bathing instead at the bacterial laden regions in your armpits and your groin, your feet. And that way my skin stays away from oil removing uh, soaps, and keeps my skin more full of healthy fat, and is more plump, and I think nice. I often get compliments on my complexion and my hair and stuff like that. And so you have to eat a healthy fat, natural protein base. Find out your blood type and use digestive enzyme if you're a blood type A, so you can eat the meat and the fish and the chicken with the skin on it, and the crustaceans and the pork and the eggs, so you can grow healthy skin and scalp. The shampoo that I use, even when I take my one shower every month or 2 months, I will only use Selsun Blue. And the only reason is I do need a soap, and I want it to be medicated with something that is also antifungal. And selenium is an antifungal. So I will put that in my hair, and that I will not put any soap on my body. I will just let what naturally runs off, and leave it at that. So soap almost never touches my body or my face, anything, just my hands as I see patients. And many doctors should know we wash our hands so many times. And can you imagine 40 years, 45 years of me doing this now, how dried out and crinkle cracked my skin would be? But it's beautiful. I'm so happy. I do put a little bit of my estradiol to the top of my hands, and I rub it like that, so that the skin to the back of my hands stays thicker. Instead of in a 72-year-old woman, it gets too thick, and you can see it gets so thin, you see the blood vessels and everything. So that's a lot to be said for the dandruff. The other thing is food allergies itself. If you eat these grains, food allergy, lectins, anti-nutrients from the plants, phytates, oxalates, and they scratch the lining of your gut, that's going to create holes, and your food will leak through. Then you'll develop antibodies to this food. And there's cellular mimicry, molecular mimicry, and this then will create cross references to natural parts of your body, some to your cartilage, some to your skin, some to your joints, your thyroid, some to your nerve membranes, like in MS and transverse myelitis and ALS. These are autoimmune antibody attacks. You can get psoriasis and things, but another way it expresses itself is through dandruff. So I would find out my blood type. If you're an A, please take digestive enzymes. Please take a rich, healthy protein and fat diet, and do not eat late. Drink adequate water. Stop all this shower and buying of junk for beauty and deodorants and stuff. I don't think once in my 44 years of practicing medicine anyone ever came up to me and said, "You smell, Dr. Ellithorpe. How often do you shower or bathe?" And I'm very open about my lifestyle. And I think for the past 25 years I've been here, I've always told my patients at most once a month I shower, and uh, use sponge bathing instead to keep soap off of me. So that's what I would say for your dandruff. Of course, you can see a dermatologist, and that the standard of care is they're going to sell you stuff, and they're going to sell you these various steroid shampoos. And I just have never needed it. My patients have done well living healthy. In general, we're designed to fearfully and wonderfully repair ourselves. Um, Debbie says, "Hello, Dr. Althorpe, and thank you for these weekly meetings." Thank you, Debbie, for acknowledging that. I enjoy doing them. There's no greater thing in life than to serve your fellow man, and especially your family and your parents and your spouse and children, of course, and friends, and then fellow employees and co-workers. They're God's greatest creation is the human being. So why wouldn't we enjoy doing this? All right. I enjoy it. All right. Her question is, I take IV chelation treatments and have had about 50 so far. I also have auras without headache. And the only thing that keeps them from occurring is half a tablet of Plavix, which is an anticoagulant, every other day. Any thoughts? I also take 10,000 of nanokinase. Yeah, well, I would ask the question, how much water do you drink every day faithfully? I'm going to ask, what is your blood sugar fasted level? What is your insulin fasted level? What is your triglyceride fasted level? What is your hemoglobin A1C fasted level? What is your sedimentation rate? What is your HSCRP? What is your hemoglobin A1C? Do you exercise? And what time do you go to bed? How late do you eat? What is your blood type? So yes, all these things impact, and IV chelations are acting as a anticoagulant, enhancing microcirculation. But if you are taking Plavix, a anti-clotting medication, then you have to answer all those other questions with a good functional doctor rather than drugging you so much. But if we take Vitalzyme or systemic enzymes, or what we call Vascuzyme, on an empty stomach, anywhere from 3 to 5, once or twice a day, we should be very, very fine and not have any clotting. All right. Then SVM also asked a question. I play pickleball and I have a sore knee. I put castor oil mixed with frankincense on my knee at night before bed, and it helps a little. Do you have any other suggestions? Thanks. Well, the same thing would have to first be asked, how much water do you drink? What is your fasting blood sugar, insulin, triglyceride, hemoglobin A1C, your HSCRP, sedimentation rate, fasting glucose? I think I said that already. And then what is your diet composed of? What is your blood type? Do you have a lot of antigen antibody production, making your blood sticky and clogging capillaries for healing? Because remember, the cartilage in your knee doesn't have a blood supply. And so it's depending on the synovial tiny artery for all the water that you drink and through diffusion to give nutrients and take away waste material from your joint fluid and the cartilage there. So I would make sure I would take 5 systemic enzymes on an empty stomach, morning and evening, not eat late. I think I don't know what your weight is, but if your weight is in excess, you might be having so much pounds per square inch beyond which you can repair at night if you're having excess weight or if your BMI is over 30. And that pound per square inch is creating micro trauma, and you don't heal as fast as you used to when you were 5, 10, 15, 20, 25. Now it takes longer to repair things, and it's harder to digest and absorb things. So that's one of the reasons why we die, is our rate of repair after use and injury slows down, and we don't repair as well. And finally, the scale balance is imbalanced, and we have more damaged cells than we do repaired cells. So you might have to look at all these factors, from your hydration to your blood sugars to your food allergies to your how late you eat to what your blood type is, your enzymes, what your weight is, and then make a decision about how to approach this. Okay, so I think I've answered all the live questions for now. Next is we'll go to the the email. So Susan asked the question. This is from last week. I have a couple I didn't get to. Susan said, I need advice identifying underlying cause of chronic strep throat and suggestions for building immune system to minimize recurrence. Read underlying cause could be low zinc and microbiome issues in the gut, your gut bacteria, your health there. To a remedy called Streptococcus salivarius, aka Bliss K12, a bacteria naturally found in the mouth that is an antagonist to strep pyogenes. God bless. Well, Susan, there's many things that need to be done. First, you need to see a doctor to do an oral exam and see if you have any teeth or cracked crowns that are generating a slow infusion every time you bite down or chew, and you're squeezing out from that little crack growing little places to harbor bacteria to grow. And that's generating a little army of bacterium. You have to get your vitamin D level up to at least 100, 120. You can check your chemistry panel to make sure your liver enzymes are normal. I've never seen a problem with that unless someone has known liver disease or is eating a high carb diet and has fatty liver disease, which indeed a lot of young people are having. We're seeing more and more self damage from the junk food, entertainment food. The marketing of everything we do has to be some self interest, self aggrandizing oral orgasm. And that junk food is just generating high carbs, processed stuff, uh, genetically modified, glyphosated, pesticide, herbicide, plant anti nutrient, oxalate, lectin, uh, phytate challenges to the human body instead of eating real meat and a real vegetable, butter, salt, and pepper. So I'm going to say get that vitamin D up, eat a low carb diet, drink plenty of water. There is wisdom to xylitol and what is it with hydroxyapatite that helps to kill off the bacteria in early cavity formation, xylitol and hydroxyapatite. There are toothpastes out there that have hydroxyapatite and xylitol in it, which kills this bacteria. You can take probiotics. There is a probiotic lozenge that you can suck on called, what is it called? Dentin, Dentin. I think that's the name of it. And it has this probiotic in it that fights strep and other pathogens that are in the mouth. You're supposed to have good bacteria in your mouth. So don't try and use Listerine or all these other products that kill off all bacteria. When it says 99% antibacterial, then you're killing off the good guys and you need them. So that's why I'm saying something like xylitol with hydroxyapatite, brush your teeth with that kind of a toothpaste, low carb diet, and get your vitamin D level up. See your dentist for any cracked crowns, or if you have amalgams with the silver fillings that often break down over years and you start getting cracks and cavities under that, generating it. Get your vitamin D up. Take vitamin C. Suck on a lozenge of vitamin C every night, 1,000 milligrams, or take a drink of Emergen C or liposomal vitamin C in a cup every day. Another thing you could do is brush your tongue, get in the habit of brushing your tongue after brushing your teeth. It'll just take a few more seconds to brush your tongue. And I use Argentine silver as a swish and swallow frequently at night before I go to bed. What else do I do besides the vitamin D? Of course, a multi-mineral that has all the minerals, including a rich zinc level. Anywhere from 6 milligrams to 25 milligrams is very adequate. Find out your fasting blood sugar, triglyceride, insulin, hemoglobin A1C, and check those things and see if that won't help keep your sore throat or recurrent chronic strep from showing up. So that's my suggestions there. Joanne says, my daughter had stomach bypass surgery several years ago. She gets sick frequently with two little ones, bringing germs home. What do you recommend that she takes to strengthen her immune system? Again, see a good functional doctor who's going to find out her blood type, check her vitamin D level, check her fasting insulin, glucose, hemoglobin A1C, triglyceride levels, and check or rather than check, just give her a good multi-mineral rich in zinc. Give her a supplemental vitamin D, then check up the D levels in a month or two later. We're usually starting at 10,000 international units per day with vitamin K2. Make sure her sugars are low, and find out her blood type, whether or not she needs help with digestive enzymes, because those enzymes are supposed to kill off a lot of bacteria and stuff. And if you don't make enough digestive enzymes from the gastric surgery, she may not be yielding enough stomach acid and enzymes. And so she might need support with a digestive enzyme every time she eats. Those acid and enzymes are supposed to kill off the bacteria. Remember, stomach acid should be brought down to around 2 or 3 pH to help kill off any pathogen that might be in the food accidentally before the pylorus opens to the duodenum and small intestine to let it enter your body. So that's the direction I would head. Another new live question is Anetta. A ear specialist noticed a small lymph node between my right ear that I've had for years. He wants me to get a CAT scan and biopsy done to check and see if it's cancerous. Given it's been 4 years, is the CAT scan necessary? I would have to see you, Anetta, and know a lot more about your general health, more of the story, to see if you have pierced ears, where that little lump is located, how big the lump is it mobile, is it tender, is it non-tender, feel all the other lymph nodes in your chain. So I would not say whether or not to do this. I would have to see you. So until you are unless I see you or you see a second opinion, I am not going to tell you not to do that. If it's been stable for 4 years, it's unlikely that it's cancerous. But there's so many factors that could go into this. People who tend to not have cancer are people who drink their water, get a good night's sleep, exercise, take systemic enzymes. They know their blood type and use digestive enzymes to help them digest their food, especially if they're blood type A and they're young. But every one of us needs it when we're about 60 years old to help us, because we don't produce as much digestive enzymes and stomach acid as we age. Another thing is to find out your vitamin D level, your sugar levels. All these things are important for your immune system, because the average range they tolerate for saying your blood sugar is normal is somewhere between 85 and 115. And that's not normal. Anyone should be under 85. So you have to see a good functional doctor that knows what they're doing, because you're not going to find good immune health with a blood sugar of 98 or 95 or 93. It's just, you're not going to do well. You have to get that down. Along with insulin, they'll let you have an insulin and call it normal all the way up to 25. I'm lately seeing the level drop to 18, but I'm telling you, if your insulin is above 5, you're not healthy and you don't have good cardiovascular glucose management, so your immune system won't be good. And if your triglycerides are much over 50 or 75, then again, you're not in good health. Your immune system is in good health. Another thing is they allow your hemoglobin A1C typically to be called normal or acceptable unto a 5.7%. And I don't like it above 5.2, 5.3%. So you see, if you don't know these things, then you will suffer a poor immune and health journey through your life, and you'll suffer some things. So if you were one of my patients and I saw all these numbers were in the safe, healthy ranges, and then you showed me this little lump and it's been unchanged for 4 years, I'd probably say, come back in 3 months and let me recheck you if you were my patient and I knew all these other factors were stable. But I don't know who you are, so you follow up what that doctor said. You might get a second opinion, but beware. Okay. And then James says, what are your thoughts on heavy metal detoxes? Well, James, I teach and have been on the board of the American Academy for the Advancement of Medicine, which means I teach doctors how to do detoxing, especially for heavy metals. So we do the intravenous EDTA. There are other types of chelators, but they're more full of side effects like penicillamine, DMSA, and I don't use these other ones because I don't want side effects. I want to do a slow, steady detoxing of these heavy metal, oxidative, stressful, what I call terrorists in the body. We need them in industry, so I'm thankful God let us learn about chelation so we could safely pull them out. So I'm very much in favor of EDTA, calcium disodium EDTA chelation therapy. The next question is Anetta. Is a CAT scan dangerous? Well, it's radiation. Okay, so anytime you get radiation from a chest x-ray to a dental exam with x-rays of your teeth all the time to a CAT scan and more, these are ionizing radiation particles that have the potential of damaging your cellular structures and organelles and the DNA and the nucleus, which may lead rise to a abnormal reading of the proteins that it's supposed to be made for. It is less risky if you're a healthy person drinking your water, taking chelation therapy, for instance, pulling out free radical generating heavy metal toxins, getting the wonderful zinc and minerals in the chelation, getting the wonderful B vitamins in it, eating a low carb diet, exercising, walking, getting a good night's sleep, getting your vitamin D level up there, having blood sugars that are in the safe ranges between, I would say, 55 and 85, getting up in the morning with the sunlight for a few minutes, grounding yourself, not eating late at night. And then if you had a CAT scan, it's probably less risky. But it depends on how many and you're getting for what reason. So we are concerned about CAT scan ionizing radiation exposure. Yes, it can be dangerous. Now back to the email questions we have next. Akira says, does a lot of saturated fat, especially butter, harm the pancreas? The answer is no. When I switched to a low-carb ketogenic diet, I started experiencing abdominal pain, and an ultrasound showed some changes in my pancreas. Well, what caused it? That just because you're eating a low-carb ketogenic diet doesn't mean that caused it. What kind of lifestyle should I follow to keep my pancreas healthy? Everything I've mentioned in the aforementioned questions. Plus, you have to find out what your blood type is. If you're a blood type A and you don't take digestive enzymes with betaine hydrochloric acid, and you start a ketogenic carnivore-like diet, you're going to have problems because in general, you don't make enough of these stomach acid and the enzymes to break it down. The cure is not to avoid the healthy fats that we need and the proteins they're usually delivered with. The key is to find out what your blood type is and take the digestive enzymes. That would be my suggestion. She also asked the question, does long-term EDTA chelation therapy using suppositories have any harmful effects on the kidneys? I know of none. I only know of benefits. So Dr. Lee, Lee, is a nephrologist that's done multiple studies on patients with chronic kidney disease in various stages of kidney failure. And every time he uses the creatinine kidney clearance improves and either improves or stabilizes the kidney function with chelation therapy. So if you go to the YouTube and watch the YouTube called Chelation Therapy Data Review and Development and Inside Look, Doroty, Doroty, Merritt, Merrit. That will show you about halfway through are all the listing of the multiple studies he's done on EDTA chelation, actually improving chronic nephrotoxicity, kidney damage and disease. Now, I don't know who's making the suppositories. I did the original research. I did the publications and the lectures. And then, of course, the corrupt FDA came around threatening and chasing me. And I'm a doctor licensed to prescribe it. And so I prescribed it and I never gave it, made it available over the internet. So I only prescribed it and I knew who made it. I knew the producer of it and what was in the suppository. Today, I don't know who is making it. I don't know if you can get it unless a medical doctor licensed to practice medicine puts it into a suppository for you. And then you're far more likely to have a healthier suppository. But some people mix it with magnesium, and that creates a lot of irritation perirectally. But I know of no risk of taking it if it's a true, safe suppository with just calcium disodium EDTA chelation. Now, how often can you do it? Well, we only used 1,500 milligrams in a suppository, and it took about 3 suppositories a week to roughly equal the heavy metal detoxing effect of an intravenous IV. And that was extremely remarkable. That's why our work got published. And that is why I used it. But of course, anything that's successful and helpful, it seems like our corrupt government swoops down, terrorizes me and others doing these good things. And then it's been snarfed away and taken away, unfortunately. Now, there are people in the alternative world who are corrupt and they'll do anything to sell you anything to make money. I don't know who ultimately was in charge of the mass production of this. My understanding is that it was only being sold to doctors who would prescribe it. But apparently, Detoximin was the name of the product, and it got into the internet, and some people were selling it without a doctor's supervision and prescribing control. And that's where the problem comes. So, you're selfish and you just want money and you don't have the love of God's people and his creation. And so a spoiled brat ruined it for us all, just like spoiled brats ruin it for everything. I remember in first grade, the first time in school, Mrs. Bazinski, my teacher in first grade, punished the whole class because of one boy. And then as the years go on, various things started happening with the hippie generation and more lockdown of wonderful things I looked forward to because my oldest sister, 7, 8 years older than me, would have all these responsibility privileges and enjoy respect and mature behavior being rewarded. But by the time I got there 8 years later, it was all thrown out the window. No more trips to Mexico City. The kids were just misbehaving. So spoiled brats ruin it. So it's our responsibility to raise up God-fearing children, to obey the law and God first, and love their neighbor as themselves. And then we'll have less of this impact and a better alternative world. Because don't think just because someone says, I do functional medicine, they're not after your money and your pockets and just selling you anything. So it's just as corrupt in standard medicine as it is in the alternative world. And that is so sad to have to report to you. All right, the next question is OD says, I would like to know if it's possible to purchase your supplement products from outside the USA. I'm particularly interested, and he lists several items. Do you offer international shipping for these products? We're not after money owed. We are after improving God's creation, and I only sell supplements to my patients because I do everything under prescription. I treat my supplements as a prescription, and so I only sell it to them. So I'm so sorry. I cannot do this unless you're a patient of mine. Sorry. Krista says, hi, Dr. Rita. I truly appreciate what you're doing every week for all of us. I'm 56 years old and I have the libido of a gnat. And I was wondering if you had any suggestions. Thank you. Well, in general, if you're 56, you're probably postmenopausal. I would say work on building up your estradiol level. I know over the years, people have pushed the testosterone, but in general, what testosterone does, again, there's gimmickry, and I just think the motive is wrong in the doctors and the alternative world marketers. It's corrupt. And that is, if you use testosterone, a lot of them put it right in the vulva on a woman where her clitoris will then start to behave more and enlarge like a small penis. In fact, that's part of the therapies in these transgender treatments. And because the clitoris gets bigger, it gets more sensitive, and then it can generate whatever. God only knows what they do in the private with it. So I am not in favor of testosterone as a general libido item. I'm for testosterone for muscle strength, health in the human female as well as men. So I do not want you to cross the idea of libido with clitoral enlargement. That's a perversion of treatment. But what I like to see is the estradiol go up and be monitored. And when the estradiol goes up, maybe to 100, maybe you would need it to 200. Then the brain, the calmness, the lubrication. A woman, if she's aroused, like a man will be aroused and he'll start feeling tumescence, his penis will feel more firm. A woman, when she's aroused, she'll feel a awareness of her vaginal area, and she'll secrete lubrication as if in anticipation she will be shortly having intercourse and need to be moist enough to receive penetration. And this is only achieved with estradiol. So you have to understand that is the correct libido natural hormone. And you have to drink enough water and so forth. So work with a good doctor who's aware of this and whose heart is in the right place, and not just for sensationalism. Because I don't know if you can reverse clitoral enlargement. I'm not sure if that's so. And Jennifer says, I'm 38, I'm in perimenopause, and my new GYN suggested I use Climera estrogen patch and take Prometrium at night. I have a history of migraine and aura, so I'm cautious. Alternatively, she suggested antidepressants or birth control. What are your thoughts on this? Maybe go to a different gynecologist or find a good functional medicine doctor that will work with you. Now, if she's stuck with just Climera and Prometrium, that is pure human bioidentical estradiol, and Prometrium is pure human bioidentical progesterone. And so I'm in favor of that. And I would start with a small dose. You can probably start with Climera at 0.025 in a patch twice a week. And the progesterone, I would always start a month later, because when God made us, he made the estradiol to build up first to make us feminine, make our breasts form and our secondary feminine characteristics. And then once we were more mature and developed, then he allowed the eggs to develop and the first ovulation to occur that generated progesterone. So you always start estradiol first, you wait about a month later, and you start using the Prometrium natural progesterone 100 milligrams. I like to use progesterone only 2 weeks out of the month, every month. If you're menopausal, then just decide, do you want the first half or the latter half? I use it the first half of the month, the 1st through the 15th, so I remember to take it. I often forget in the middle of the month to start it on time, so I start the 1st. And have them check your blood levels and see how you're feeling and if your migraines are aggravated at this lower dose level, and compare that to the blood levels. And then you can move up next to the 0.0375. In other words, we can gradually move up until you're feeling vitality, vivaciousness, you sleep well, you have a normal sexual response with your husband, and move forward like that. The other thing I want to say, though, is nothing works unless you have a fertile, healthy field, meaning you drink enough water, you're low carb, you're exercising, you're getting up in the morning with the sunrise, so you are in a acclimatized, so to say, acclimated to the sunrise and the sundown for your circadian rhythms. And you're eating a low carb diet and have a good vitamin D level and not eating late, those kind of things, because nothing will work in a body that's abused. All right, so that ends that page. Do I have any new ones? Yes, Tim says, hi, Dr. E. A 68-year-old male friend with high coronary calcium scores 1 year ago. He just was diagnosed with fatty liver disease, a history of prostate cancer. Doctor recommended statins, which he won't take. What should he do about the calcium? He's got to see a good doctor in functional medicine who is going to give him vitamin D with vitamin K2, check his vitamin D levels, check his fasting glucose, fasting triglyceride, fasting insulin, fasting hemoglobin A1C, and check his with his liver enzyme on a comprehensive chemistry. Get him exercising with weight training 3 times a week for 30 minutes, doing a brisk 20-minute walk every day, going to bed on time, not eating late, trying to get him to stop eating around 4 o'clock in the afternoon, and do EDTA chelation therapy. With a vitamin D, I would recommend a methylated B complex. I would recommend Juice Plus. By the way, Juice Plus was just selected yet again by another university. This one is the National Institutes of Health for its vineyard blend, the berries, for the polyphenols that are so rich in them, associated with much less DNA damage, oxidative damage to the human body. So I think everyone should be on Juice Plus with a low carb diet. Drink the adequate water, and then take a multi-mineral that has selenium in it. We have TLC multi-minerals. Try and get 200 micrograms per day as a bare minimum of selenium. If you eat a healthy meat, fish, chicken, pork diet with eggs, you're going to get a lot of good minerals there just in your food that are much more bioavailable than we can ever make them. But the kind we use is the Albion amino acid chelated minerals. So ours are much better absorbed on studies. So that, along with the vitamin DK2, will help with the preventing calcium buildup and may, in fact, reduce calcifications. He can repeat that CT calcium score in a year if he's dedicated and dutiful with his low carb diet, intermittent fasting, or even a prolonged fasting every 3 months of 2 or 3 days, depending on his health. Now, I don't know if he's a diabetic. I don't know if he's obese now, hypertensive, on other medicines. So he would have to see a good functional doctor to see if he could do these prolonged fasts and stuff. But he's got to drink the water, exercise, not eat late, use systemic enzymes to bring inflammation down, use the DK2 to help with calcium metabolism, and so it's not deposited in soft tissues. Be on a good multi-mineral, be on Juice Plus, be on a methylated B complex, and then do the nuclear stress test to make sure the calcium score doesn't show any lack of perfusion. Have a good cardiologist, and then see where he goes from there. Jenna says, hi, Dr. Rita. My iodine level is 0.16 milligrams per gram. I rub on a couple of drops of Biotics Research liquid iodine on each breast weekly. What iodine level do you recommend? Thanks, and God bless you. Jenna, I don't go by iodine levels. I don't know the testing there. 0.16 milligrams per gram. Instead, the way I manage it is, if you read Dr. David Brownstein, his book, and my personal experience for the past 30 years, because he wrote that book about 30 years ago, and I know of him, and I'm in these circles when I was on the board of ACAM. And it said that 96.7% of all Americans are iodine deficient. So take a 50 milligram iodine challenge and then collect 24 hours of urine and send it off to Doctors Data in St. Charles, Illinois for testing. That's Doctors Data. Dr. Quigg, Professor Quigg, is the one who runs the test. I know him. We've had conversations about many things. And he runs the test on the fact that if you needed the iodine, and 96.7% of us are deficient and we need it, then when you take that challenging dose of 50 milligrams, you're going to hold on to a lot of it. Your body won't let it go out of your body. And you'll only pee out in your urine maybe 50, 60% of the iodine. well, then you're really severely deficient. I don't recommend putting anything on the breasts. I don't put progesterone on the breasts, estrogen, nothing on the breasts, um, and that includes iodine. And yet, the breasts are metabolically, glandularly active and needing iodine for their activity. Same with your thyroid. Same with the prostate. So I would tell you that don't put these things topically on the body. Uh, I am unaware of there being any great value and studies that are published on this, whereas we have decades of research and data on the oral iodine called Iodoral, by David Brownstein, medical doctor, lots of research. Take at least one tablet a day, 12.5 milligrams. The Japanese, the Asian people eat a lot of seafood, seaweed products, and their average daily intake is anywhere from 12.5 to 50 milligrams a day. And their breast and prostate cancer is so low compared to us. So this is what drove Dr. David Brownstein to do the studies and get that at a 12.5 to 50 milligram range dosing. So there you go for that. All right. And then Tim V says, thank you. I love you. God bless you. God bless you too, Tim V. And then another lady said, hello, I am currently 27 weeks pregnant. OB doctor wants me to get the Tdap vaccine to build antibodies for babies. Should I get it after birth? Should my babies get erythromycin, eye ointment, vitamin K, and hepatitis B? In general, I have to medical legally say I am not a pediatrician or an obstetrician delivering babies anymore. I am not in favor of the industry with all this lack of credibility on any of the research. You know, they did the hepatitis B study, I believe, which is given on the day of birth, and they only watched them for 5 days, is my understanding on the study, and that's never enough time to look for problems. I don't know why you would give hepatitis B to a newborn. That's a sexually transmitted disease. So that seems foolish to me, in my humble opinion. Also, the thing we used was silver in the eyes. We use natural, organic Argentine silver drops in the eyes if there was any irritant. Now, if the mother's healthy, she has no sexually transmitted diseases, no active herpes. If you did or have any infection vaginally, they would do a C-section anyway. But if you're a healthy mother, then there should be no problem. As to pertussis and things like this, I'm going to say the mother is sharing her antibodies with the baby. So your breastfeeding should have the antibodies in the immunoglobulin colostrum that was designed by the creator to be enough for babies born for the past 6,000 years since he made heaven and earth. So with all the corruption in the industry and no liability for being sued, the vaccine producers have no real motivation other than to sell, baby, sell those vaccines and give financial reward to pediatricians per volume of vaccines given. So the motivation of the pediatrician tends to be sell, baby, sell those vaccines, rather than looking for doctors who are pediatricians who have populations of children whose parents refuse this and have watched their population of patients over the decades, and they find that these children of the unvaccinated don't get the autism and the neurodegenerative autoimmune phenomena that the vaccinated ones do. Dr. Bob Sears, Sears, he's the son of Bill William Sears, who promotes the Juice Plus for children. That doctor was hounded as a pediatrician just because he wanted to delay vaccination with children and schedule them further out. So we have a very corrupt system. It is very political, and I can't see any value or honor in it in the current life. So I'm unable to give any informed consent to a parent of doing such or dealing with such a corrupt system, it would appear I cannot give informed consent for any of that. All right, and then the next question is, thank you, love you. Okay, God bless you too. Alexandra says, sorry if I went through on email, I was having difficulty. Okay, so we got that, Alexandra, great. Whitlock, grateful for you, Dr. Rita. Okay, thank you. Well, I'm grateful for all of you. When using the analemma rod, is it better to put it in the water or is stainless steel? Okay, it's fine in water or stainless steel jars. It's just the crystal is going to talk to the fluid in the container. Stainless steel is nice and inert. It's just fine that way, and it'll help create structured water, and it will energize your body for health and longevity. Gina says, my blood type is AB positive. I take a seed brand probiotic, prebiotic daily. My digestive health is great. Do I need to take digestive enzymes? I know you recommend that for people with blood type A. No, I would say I'd wait until you're 60 years old, and if you're 60 and having any gas, bloating, you can sense food staying in your stomach longer. This is the way of age and the way of death. So if the longer we live, the slower we digest, the longer the food stays in the stomach, and we start to not digest it, and we lose the nutrition, and we die. So Jenny, you can try it. You can say, look, I'm going to eat a big steak. I'm just going to take one digestive enzyme. Of course, I'm recommending Ortho Digeszyme that we use. We private labeled it digestive enzymes, but it's orthomolecular's digestive enzymes. That way we can sell it to our patients a little cheaper. And just all of us with age probably need to start doing it at some point. I started around age 60 or my late 50s, and I'm just B type. But I tend to eat too fast and gorge it down from all my years of being a doctor. I was in the ER and I would swallow, I would wolf down a whole hamburger or a lousy piece of pizzas because there was no time to eat. It was just a terrible emergency room, crisis after crisis after crisis. And so a lot of doctors harm themselves and die too young because of this and from poor medical management. Okay, so let's see if I can get the last item here. Do I think vibration tools are effective for muscle healing? Well, they'll help oxygenation, circulation, and some toning, but it's not going to be the end all be all. These vibrational guns and plates that people are using are probably helpful for beginning, but look at, you need to really get the person in with physical therapy, training them, doing real resistant weights, not thinking they're going to get any significant help on these plates. I know OsteoStrong is using that, and I am holding my opinion on OsteoStrong companies being built up until they have a lot of data. I'm not going to trust that. Jennifer says, can too much calcium cause calcification? I never prescribe calcium. Never, ever, ever, ever. I use a multivitamin mineral where the whole thing is in a multi-mineral grouping, but no, I'd never use it. I don't. It gets dumped. It doesn't get utilized. That's a false wives' tale. All right, she says she has calcification on her rib cage area. She's 68, slender, and has severe scoliosis. So you need to work with physical therapy, a trainer that helps you exercise as much as you can, and to eat a rich protein diet, and take systemic enzymes, anti-inflammatory, plenty of water, and work with a good functional doctor, but please don't take calcium. Denise says, how long does it take for glucose to come down to better numbers once doing a keto carnivore eating? It depends on how honest you are. I find we are all humans. We all sin. We tend to lie or exaggerate and minimize our failures and amplify our successes beyond to what they truly are. And we're often lying to ourselves, eating too many carbs of a vegetable, too many carbs of fruit. And so if you're doing that on what you're calling a keto diet, your blood sugars take a long time to come down. I would say just think of boot camp, where they put the young men in boot camp for 2 months, 3 months, and they come out being controlled and really go through the ringer, but they realize the great possibilities of what they can do. And I'm equating that with, you don't understand how fearfully and wonderfully you're made. And if you do the right thing and you stay on track and you do it hard for 3 months with like a straight carnivore diet, then your blood sugar will more quickly, dramatically drop. That is what I'm going to say is likely better to understand. Alexandra says she's 27 weeks pregnant. All right, we did that one already. Manja says, is there another way of getting rid of E. coli bacteria? The urine culture test was positive for this bacteria. No, if you have a cultured urine that's 100,000 of E. coli, you have to take antibiotics. Now, to prevent it, you might use D-mannose in water every day and cranberry extract. We call it Uratrac here. So we have Uratrac and the other one is called Cystistem or something like that. One has the D-mannose and one has the cranberry in it. And Laura says, what's your opinion on supplements, powder or capsule, that contains grass-fed beef organs, collagen, and colostrum? If you like them, do you prefer powder, capsules? Do you have a brand you like? Thank you for the time you take for doing this. I am for eating the real food. I am for healthy lifestyles, like we said in the beginning of this. If you take a beef liver extract, which is dehydrated, desiccated liver ground up and put into capsule, that's probably a better thing because I can get a better idea of the amount per capsule and how much you're getting. But I would strongly encourage you instead to just eat the liver once a week, or eat meat and eat meat and eat chicken with the skin on it, not deep fried, roasted. Eat the salmon, eat the tilapia, eat the, lobster, shrimp, eat the pork, eat the bacon, eat the eggs, and you'll get all these wonderful proteins, all the collagen you need for your body. We don't have to buy stuff. And my son will get angry with me because we are, the good Lord allows us to make enough to stay open, but I am not trying to sell things. I'm trying to change you to eat right, live right, and be an example to other people. Not to say, look at me, I do what I want and I take a vitamin. Okay, not saying that's how you do it. It's just, please live right, and we won't have to buy all these things. So the Lord bless and keep you. I went way over today, but I enjoyed doing it. Work out, take care, love each other as you love God, and love your neighbor as yourself. And I'll see you next week. Take care. Sign and like and subscribe, please. Bye-bye.